Community assessment. Individuals experiencing homelessness in downtown Toronto,
Hey
Ontario.
everyone. A community assessment is a systemic process used by community health nurses to identify a population's health needs, health strengths, resources, and properties. It guides evidence based planning, health promotion, disease prevention, and advocacy. For this assessment, we focus on individuals experiencing homeless in Ontario because homelessness is a major public health issue that affects access to healthcare and overall well-being. In this presentation, we will explain why we selected this community, describe the population, discuss our assessment methods, identify strengths and challenges, examine advocacy and ethical considerations, and conclude with our key learning. We selected individuals experiencing homelessness in downtown Toronto because homelessness remains a significant public health issue. Downtown Toronto has many community resources, including emergency shelters, drop in centers, community health centers, outreach programs, and harm reduction services. However, homelessness continues to increase due to rising housing costs, limited affordability housing, mental health concerns, substance use disorders, and barriers to accessing healthcare and social services. The City of Toronto's 2024 Street Needs Assessment also reported a significant increase in homelessness since 2021, highlighting the need for coordinated community health, nursing interventions, and policy action. Our community assessment focuses on downtown Toronto, including neighborhoods such as Moose Park, Recent Park, and the others. These areas have many shelters, outreach programs, food programs, and community health centers that support people experiencing homelessness. The population includes adults experiencing chronic homelessness, youth, families, seniors, indigenous people, refugees and newcomers, veterans, and individuals living with mental illness or substance use disorders. This diversity highlights the need for comprehensive and culturally safe community health services. The City of Toronto 2024 Street Needs Assessment estimated that approximately 15,400 people were experiencing homelessness in Toronto, more than double the estimates from 2021. The assessment identified lack of affordable housing, inadequate income, unmet health needs, and mental health challenges as major contributors to homelessness. Approximately 64% of respondents reported at least one health challenge, and 75% reported needing help accessing primary health care. Instead of listing general organizations, use actual downtown Toronto service. For example, below are organizations that provide shelter, primary health care, outreach nursing, mental health care, addiction support, housing assistance meals, and case management.
Our community assessment is guided by three approaches: a needs assessment to identify health concerns and service gaps, an asset based approach to recognize existing community strengths, and a population health approach to examine how social determinants such as housing, income, and access to healthcare influence the health of individuals experiencing homelessness. We will use a combination of assessment methods, including a windshield survey to observe the physical environment and available community resources, a review of secondary data from reliable Canadian sources, and where possible, information from key informants such as outreach workers. Together, these methods will help identify priority health issues and guide evidence based nursing interventions. Use reliable sources including Statistics Canada, the Public Health Agency of Canada, the Canadian Observatory on Homelessness, CAI, local public health units, and municipal housing reports. These sources help identify key health priorities, existing service gaps, and areas where community health interventions are needed. Addressing community challenges requires recognizing both barriers and existing strengths. Community health nurses play an important role by building partnerships, providing outreach education, advocating for safe and equitable care, and connecting individuals with resources. Existing strengths, including shelters, food banks, community health centers, harm reduction programs, peer support, and mobile clinics, help improve access to essential services and promote community well being. The importance of engaging key stakeholders and gatekeepers in addressing homelessness. Stakeholders such as shelter managers, outreach coordinators, public health leaders, and housing departments provide essential services and support. Gatekeepers influence access to resources, so involving them early helps improve collaboration. Community engagement should include focus groups, community meetings, trauma informed interviews, and indigenous led consultations to ensure diverse voices are heard. It is also important to include often underrepresented groups such as unsheltered individuals, indigenous peoples, LGBTQ2S communities, youth, and refugees to create inclusive and effective solutions. Effective communication helps community health nurses build partnerships and improve access to care with gatekeepers and stakeholders through interdisciplinary team meetings and case conferences, and meeting regularly with outreach coordinators to identify service gaps and improve access to
There
care.
are several other possible assessment methods that could be used, including community mapping, focus groups, community forums, asset mapping, environmental scans, GIS mapping, photo voice, and health impact assessments. However, our group did not select these methods because they may require additional time, resources, technical skills, or ethical approval. Instead, we use needs assessments, windshield surveys, key informant interviews, and existing data review, as these methods provided relevant information and were practical and achievable within the scope of our assignment. This assessment has several strengths, including the use of multiple methods, Canadian evidence sources, and the inclusion of lived experiences to provide a comprehensive understanding of community needs. However, limitations exist, such as challenges in identifying hidden homelessness, time constraints, and difficulty reaching some population. Community health nurses support advocacy by promoting affordable housing, health equity, mental health services, harm reduction, and social justice. Ethical practice remains essential through respect, confidentiality, informed consent, cultural safety, trauma informed care, and equity when working with vulnerable communities. Community health nurses extend their role beyond providing direct care by advocating for policies that address the underlying causes of homelessness. They support increased investment in affordable housing, expanded Housing First program, greater access to primary health care, and enhanced mental health and addiction services. Nurses also collaborate with organizations such as Canadian Nurses Associations, the Registered Nurses Association of Ontario, Public Health Ontario, municipal government, and community agencies to influence public policy. Through advocacy and partnership, they contribute to creating healthier communities and reducing health inequities. Our recommended interventions aim to improve both individual and community health outcomes, increasing access to primary health care support, early detection, prevention, and better management of health conditions. Improving mental health, support, and housing stability can enhance overall well being and help reduce the cycle of homelessness. Promoting vaccination and preventing care strengthen community health, while reducing emergency department visits and hospital admissions helps improve healthcare access and system efficiency. Overall, these outcomes support a healthier, safer, and more equitable community. Through this assessment, we learned that homelessness is influenced by social determinants of health, including poverty, housing insecurity, mental health challenges, and systematic barriers. Our key lessons include the importance of identifying community needs, developing partnerships, and advocating for vulnerable population through evidence-based approaches. Community health nurses play a vital role in assessing community needs, connecting resources, and promoting health equity. These efforts help create meaningful changes and improve health outcomes for individuals experiencing homelessness.
For our group reflection, we learned that homelessness is a complex health issue influenced by social determinants of health, including housing, income, mental health, and access to healthcare. We gained a better understanding of the role of community health nurses in promoting health equity through assessment, advocacy, collaboration, and health promotion. Working as a group strengthened our communication, teamwork, and ability to use evidence based approaches to identify community needs and develop solutions. Below are the core theory framework we used. These are the references we used.
Thank you. Presented by Eunice, Janine, and Joanna. Together, through partnership, advocacy, and compassion, we can build healthier communities where everyone has a place to call home.